Tobacco smoking is the leading cause of preventable disease, disability, and death in Canada. In 2013, the overall prevalence of smoking among Canadian adults 15 years and older was 14.6%. That's equivalent to approximately 4.2 million Canadians. And that is why we created the Ottawa model for smoking cessation. The Ottawa model is a simple step-by-step approach for integrating smoking cessation treatment and support as part of routine care in healthcare settings. It increases the rates at which healthcare providers advise and assist smokers to quit. It increases long-term smoking abstinence rates. And it reduces downstream healthcare use and risk of premature death. How our program works. We emphasize that clinicians and healthcare providers should identify smokers and offer treatment to every tobacco user who visits a healthcare setting using available counseling strategies and medications. We help change healthcare provider practices to make sure smoking cessation support is systematically provided to all patients who smoke. The Ottawa model is a practice change process using evidence-based smoking cessation treatment protocol. It consists of 6 phases. Phase 1 is the introduction, a kickoff meeting to introduce the Ottawa model's activities to leaders at your organization. Phase 2 will be the pre-implementation screening. It's to gather the baseline data and to determine the effectiveness of the Ottawa model at your organization. Phase 3 is the program planning and protocol development. Your OMSC implementation specialist will work with a task force to amend organizational policies and create a smoking cessation treatment protocol for your site. Phase 4 is training and promotion. Here, we will assist you with promoting your program launch and will provide practical on-site training for all staff. Phase 5 is the program implementation, will be your site's go-live date. Phase 6, we will conduct a post-implementation evaluation and continue with program sustainability. A study by the University of Ottawa Heart Institute and the Institute for Clinical Evaluative Sciences showed that 35% of smokers who received the OMSC were smoke-free at 6 months, compared to 20% of usual care participants. Smokers who received the OMSC were 50% less likely to be readmitted to the hospital for any cause, and 30% less likely to visit an emergency department within 30 days. The cumulative mean healthcare cost over 2 years show the Ottawa model saves hospitals over $4,000 per patient. So investing between $80 to $440 per patient who smokes can save you $4,100. Smoking cessation, a healthcare no-brainer. Our products and services. The OMSC team facilitates practice change by offering the following products and services to our partnered sites. Assistance with program development and implementation through facilitation and our OMSC implementation work plan. Customized practice tools and resources. Training in the delivery of smoking cessation interventions. Patient follow-up and program evaluation. An electronic medical record, the EMR integration. Smokers who received the OMSC were 21% less likely to be re-hospitalized, 9% less likely to visit an emergency department over 2 years. And most importantly, smokers who received the OMSC had a 40% reduction in risk of death over 2 years. The Ottawa model for smoking cessation is adaptable to any type of healthcare setting. It increases how often healthcare providers advise and assist smokers trying to reduce or quit, which leads to increased long-term smoking abstinence rates, reduced downstream healthcare use, reduced premature risk of death, and results in the identification, treatment, and follow-up of smokers as part of routine care, is cost-effective from the hospital payer perspective, and results in fewer healthcare costs of patients who receive the program.